More than 1 year after the United States reported its first COVID-19 case, here in Texas alone, we've surpassed 2.6 million COVID cases and more than 42,000 deaths. And here in the Rio Grande Valley, we've been one of the most devastated regions in the country and state. And tonight, I'll tell you one of the reasons why. Celine Sanchez lives in Mission and has type 2 diabetes. She is also a COVID-19 survivor.
I felt like I had like a sinus infection, like pressure behind my nose. So I didn't really think anything of it.
For the most part, Sanchez's symptoms were mild.
The body aches, my temperature only hit 101 just one time.
But this has not been the case for many other diabetics in the Rio Grande Valley battling COVID-19, like Johnny Yanez from McAllen.
I went outside. I sat outside for 3 hours praying to God and hoping that I would get my breath back because I was really short of breath with a horrible, horrible headache.
Yanez says at the peak of his battle, he wasn't sure he'd make it.
I ended up calling my pharmacist friend at 7 in the morning that I needed oxygen desperately. I needed a nebulizer desperately, that I needed nebulizer treatments. So everything was sent to me an hour later. Thank God I knew people that could send me all that.
Others in the valley were not so lucky, and Yanez says he's fortunate he can tell us this story now. But it was truly a battle, a 2-month-long fight.
I still have residuals. I still get lightheaded sometimes. There's times I lose my taste and smell, and you come back. It's the weirdest thing.
And Yanez believes diabetes played a direct role in his slow recovery.
I definitely think it slowed it down. I think had I been a healthy 58-year-old male, without diabetes, without heart disease, I think I probably would have been up and at 'em, in 2 weeks after I got it, but no.
Here in the Rio Grande Valley, doctors say about 28 to 30% of the population is diabetic. And according to recent COVID-19 studies, it shows patients with diabetes have 4 times the mortality rate and an increased length of stay in comparison to people without it.
That hyperglycemia, which is high blood sugar, will increase inflammation in the blood vessels, right? And so what you end up getting is you get leaky blood vessels because of the high blood glucose. And you also get an impaired immune system that's not able to fight the virus as well.
Doctors say they're still tracking data to find out how many people who died from COVID-19 here in the valley also had diabetes. Because the pandemic is still ongoing, this data is not available yet, but doctors say there is a relationship between the two.
So they are, and there has been some research into that showing that the people that are most likely to die within 7 days of a positive test are actually people with type 2 diabetes, or rather diabetes in general.
But what makes the diabetes rate here in the valley so high?
I'd say it's both generational and genetic. So the high prevalence can be linked to, socioeconomic status, and that can be a barrier to the affordability of foods.
Flour tortillas that we all love, the pastries, the pan dulce that we call, all that stuff is not good for us. And we all know that. We know that.
According to the CDC, approximately 1 in 4 low-income residents in Hidalgo County have access to healthy food. More than 1 in 6 residents experiences food insecurity.
The eating habits are something that are usually developed generationally. And, what families eat together inculcate this pattern of consumption.
To date, more than 4,000 COVID-related deaths has been reported in Starr, Willacy, Cameron, and Hidalgo counties combined. And while doctors say diabetes may be a contributing factor, many wonder where we go from here.
Just for the health of our community, there's going to have to be something that increases access to clinicians so that we can help take care of those people.
And with better access, many are hoping to drive down the prevalence of diabetes here in the valley. The CDC says if you have diabetes and you contract COVID-19, here's what you should do. Continue taking your diabetes pills and insulin as usual. Test your blood sugar and keep track of the results. Make sure that you have at least a 30-day supply of your diabetes medicines, including insulin, and call your healthcare provider if you have concerns about your condition or feel sick.